Good evening. Welcome back to our weekly stats report. My name is Sara, epidemiologist at the Jefferson County Health Department, and tonight we are reviewing the week 39 COVID-19 data. The CDC week 39 began on Sunday, September 20th, and ended on Saturday, September 26th. We will be reviewing some of the main pieces from all of our weekly reports, but let's start off as always with a detailed review of the weekly COVID-19 surveillance report for the entire county. The weekly total COVID-19 surveillance report includes our community-based cases as well as those long-term care facility cases. During week 39, we had a total of 443 confirmed and probable COVID-19 cases in Jefferson County. Our year-to-date total is 4,431 cases as of Saturday, September 26th. We are reporting 61 COVID-19 associated deaths, as well as 19 outbreaks in those long-term care facilities. Outbreaks in the long-term care facilities are defined as one or more confirmed cases of COVID-19 in the residents or in the staff. Starting off with Table 1, you'll see the number of confirmed and probable cases by week. Column 1 shows that CDC week, and in column 2, you'll see the CDC week start date. Although the end dates are not listed, remember that each CDC week runs from a Sunday until a Saturday, so that date that you'll see on many of our reports just represents the beginning of the data collection for that particular week. During week 39, we had 443 confirmed and probable cases, which was a decrease from the number we were reporting during last week, week 38. Again, this table includes both our lab confirmed and probable cases. The lab confirmed cases include those individuals who receive a positive result from a diagnostic test, and those probable cases are very important to include in our count because they are individuals who have met two very specific criteria. So one, they were a direct contact of a positive case, and two, they have become symptomatic since having been in contact with that positive case. So the likelihood that they have COVID-19 is very high. They have a direct link to a positive case and are actively ill. So they may just be waiting on a test result, or they may not have even been tested yet. In Figure 1, we see the confirmed and probable cases by week in bar graph form, which helps to show how our weekly case count is moving. So we are always going to see those fluctuations from day to day or even week to week. And that's why it's important that we look at that overall view and not focus too much on the specific numbers. So we are certainly happy to see a decrease in the weekly case count, but let's all continue to work hard to get that number moving down even more. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is that number of daily new cases, which, as you can see, it does fluctuate from day to day. And that solid blue line is the 7-day average. So that helps us to smooth out those fluctuations in the data. This 7-day rolling average of the cases is one of the main indicators that is used for the color guidance chart for our county. So although we did see a decrease in the 7-day rolling average of daily cases, our numbers from last week still indicate that we are in the red status. Next, let's look at the overall age group data in Figure 4. The 20 to 29 year age group still has the highest number of cases with 743, and the 80 plus age group still has the highest rate per 10,000. Each age group experienced a very similar increase in cases last week, so we didn't really see any one particular group that experienced a larger rise in cases over the others. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. There are now 61 reported deaths in our county, most of which have been in our 80 plus age group. 17 of these deaths have been in the general community, and the rest were members of the long-term care facility community. Our cumulative fatality rate is now 1.38% in Jefferson County. This rate is lower than both Missouri and the United States. Missouri's fatality rate is 1.67%, and the fatality rate for the US is 2.89%. Moving on to Figure 7, we have the COVID-19 PCR test results by week, as well as a nice visual of that percent positive rate. So this data only includes those lab confirmed cases. It will look a little bit different from our main weekly case count because it does not include those probables. That dark blue dashed line that you see is our percent positive, and right now it's around the 13% mark. So let's look at table 3 where we can actually see the values of the positive and negative test numbers. In week 39, we had 418 lab confirmed positive cases. So this number does not include the probable cases, and it also does not include any duplicate test results. Each individual person is only counted once, no matter how many positive test results they receive. Our percent positive for week 39 is currently 13.2%. As many of you know, this percent positive tends to stabilize after a couple weeks because we do continue to get negative reports well after this report is published. I always keep these numbers as updated as possible, so the small fluctuations in the data should be expected as more reports do come in. Moving on to table 4, the COVID-19 cases are divided up by race and rate per 10,000. The white population in the community has the highest number of cases right now with 3,226, as well as the highest rate per 10,000. As a reminder, we do not include any missing or unknown race data when we are calculating these rates. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation or quarantine period. We do have a few areas who have noticeably higher amounts of cumulative cases than other areas. Many of those same areas also have over 100 active cases at the moment. Arnold 63010 has 184 active cases. DeSoto 63020 has 143 active cases. Festus 63028 has 132 active cases. And Imperial 63052 has 134 active cases. For the last piece of our main weekly surveillance report, I'd like to show our cases by zip code per 10,000 residents. The rate per 10,000 takes the population of each individual zip code into account, so this helps to give a fair comparison among some of those areas that have higher populations or smaller populations. Right now, Herculaneum 63048 is the area that you see with the highest rate per 10,000. This area experienced a 26% increase in cases from last week. For our hospitalization data this week, we are once again going to take a look at the data we received directly from those local hospital systems. We are currently receiving information from BJC and Mercy facilities and are still actively working on receiving that data from SSM. So what this means is that that hospital system report that you find on our website, as well as the data that I present to you today, is not necessarily complete data. What is presented to you in those hospital reports, as well as during these videos, is meant to give you a snapshot of what's occurring in our community. And it certainly should not be used in any context that would imply that these are the only hospitalizations and the only hospital deaths that are happening in our community. In this particular report, we define a hospitalization as any time the hospital is utilized by a positive COVID-19 case. As of week 39, a total of 332 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 40 of these cases have been admitted to the ICU and 16 positive COVID-19 cases required ventilators. In figure 1, we see the COVID-19 hospital admissions and a 7-day average of those admissions. We had a dip in admissions right around mid-August, but they have been continuing to rise since then. We tend to have some fluctuations in those admissions, which you can tell by the jagged shape of our line. Our data usually does have a little bit of a lag, which is why most of the time when you look at this graph on this report, there is a drop there at the end. We haven't received data pertaining to the admissions from this past Saturday yet. What we do want to be paying attention to, though, is the direction that our line continues to move as we go along. We really don't want that line to get any steeper because we certainly don't want to take any chances when it comes to the availability of our hospital resources. Next, we will take a look at the length of hospital stay. We had a cumulative total of 131 emergency room visits. There are currently 31 Jefferson County residents who are still in the hospital at either BJC or Mercy facilities and are COVID-19 positive, which is an increase from last week's current inpatient count of 22. Most of our hospitalized residents remain in the hospital for 1 to 2 days, but there is also a good amount of residents who have been staying much longer than that as well. Next, let's look at the current school-aged population data. As of week 39, there have been a total of 617 lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. And during week 39, there were 73 cases reported for the 0 to 19-year-olds, which was lower than our total weekly cases for week 38. In figure 2, we have the cumulative cases and active cases by zip code for our 0 to 19-year age group. And let's focus on those orange active cases, so the cases that have not yet been released from isolation or quarantine. 3 areas have more than 10 active cases for our 0 to 19-year age group. Those areas are DeSoto, Festus, and Imperial. With the start of flu season this week, it'll be even more important to continue reinforcing those good hygiene habits. So let's make sure our kids know and understand the importance of hand washing and understand why it's important they wear their masks. Lastly, let's review the weekly community-based surveillance report, which excludes the long-term care facilities. In figure 1, we see the weekly case count, excluding the long-term care facility cases. During week 39, 417 were community-based cases. This means that the spread is really coming from our general community at this point because only 26 of those cases for the week were found in the long-term care facilities last week. Those cases come from both the residents and the staff of those facilities. And just like our main weekly surveillance report, the weekly case count has decreased from week 38. 417 cases is still higher than where we'd like to be at this point, but we will certainly keep hoping for progress as we move along, no matter how small or large it may be. When we look at the age group data for our community-based cases, once again, that 20 to 29-year age group has the most cases with 700, and they also have the highest rate per 10,000 with 269.2. And lastly, for our zip code data, excluding the long-term care facilities, our top 3 zip codes in terms of cumulative number of cases is Arnold 63010, Festus 63028, and Imperial 63052. All 3 of these areas are either very close or above that 500 total lab confirmed and probable cases for their area mark. Please be sure to refer back to our website to get more details and recommendations on our COVID-19 homepage. Leave us any questions that you may have in the comments or reach out to us via direct message. Have a safe and healthy rest of the week, and thanks again for spending some time reviewing the stats with us. Have a great night.